topic of our live for this evening is adenomyosis. This is a very widely discussed topic on Dr. Asti's social media across TikTok and Instagram. So before I get into the questions, I'll just pass over to Dr. Asti for a brief introduction on the topic.
Thank you. Thanks, Gabriel. Thanks for everyone joining the live stream. Yes, so today we'll be discussing adenomyosis. Mainly we'll be discussing adenomyosis in the context of infertility and IVF. So first I will explain what adenomyosis is, and the second I will explain the impact of adenomyosis on fertility and IVF. So generally, adenomyosis means that endometrial lining, which would grow inside the uterine lining, so when this endometrial lining ends up in wrong place inside the wall of the uterus, that is caused adenomyosis. So generally, as you know, that uterus has got 3 layers. So if you look uterus from outside, when you do keyhole surgery, you have a outer layer, very thin layer of sheet, which is called perimetrium. So then you have a middle layer, which is the thickest layer of the uterus, which is called muscle layer. Then the third layer of the uterus, which is located inside the uterus, which covers inside surface of the uterus, that's called endometrium. So, and you have a very clear demarcation line between these layers. So in adenomyosis, you have a breach in endometrial plate. So then endometrial lining starts growing into the wall. Essentially, it's invasion of the endometrial lining into the muscle layer of the uterus. So, so normally what happens is in the first 14 days of menstrual cycle, ovaries start developing follicle with the egg, and that follicle produces estrogen hormone. So endometrial lining is very sensitive to estrogen. So when estrogen is going up, endometrium wakes up. So inside the layer of the inside the uterus, the endometrial cell starts growing and multiplying and creates a new layer of endometrium, which we call functional layer. So main stem cell layer of endometrium stays attached to the wall, and functional layer grows. So after ovulation, the same follicle produces progesterone. So if pregnancy doesn't happen, when progesterone drops, then you have a menstrual period, which means the detachment of the endometrial layer. So, and when detachment happens, it comes out with menstrual blood. But in adenomyosis, same process happens. So in adenomyosis, we have endometrial cells growing in the wall. And then when detachment happens, these cells cannot escape, and these cells end up staying in the wall of the uterus. So, and because there's no channel, and it stays in the wall. So this process keeps happening every month. Let us say it happens 12 times a year, then over many years, it happens so many times. So these endometrial cells get built up inside the wall. So what happens normally is immune cells come and remove those abnormal endometrial cells from the misplaced muscle layer, and clear those cells. But when this happens repeatedly, the immune system cannot catch up, and all this cells stays in the wall of the uterus, causes inflammation. So inflammation means immune cells are fighting with the misplaced endometrial cells, which causes inflammation of the uterus. This is why in patients with adenomyosis, you can see all the signs of inflammation. One of the signs of inflammation is the swelling of uterus. Patients with adenomyosis have a larger, more swollen uterus. And also when inflammation happens, you have erosion of the tissue. So erosion means like any erosion, so the tissue planes get eroded. So erosion can happen in the wall of the uterus. So you can see that different patches of defects on the muscle layer. You have a cystic fluid in the muscle area. And also you can have erosion of endometrial plate. So if you have adenomyosis of endometrial plate, which is junction, we call junctional zone, so junction between endometrium and the muscle interface, then you have a defects, various erosions, defects on that plate. So this is a sign of inflammation. So yes, Adenomyosis is a condition where you have ectopic, misplaced endometrial cells in the wall of the uterus, in the muscle layer. So if same thing happens outside the uterus, if endometrial cells gets misplaced outside the uterus, we call this condition endometriosis. So endometriosis and adenomyosis are related conditions. The only difference is endometriosis, this misplaced glandular endometrial cells you will find in the pelvis. In adenomyosis, you find those cells in the wall, entrapped inside the wall of the uterus. Essentially, in this condition, you have got, like, let us imagine uterus like a room. So you have got a crack on the surface. Then you have a tracking of the fluid, endometrial fluid or endometrial cells into the wall and getting stuck in the wall and causing erosion and fluid collection, or cyst collection in the wall of the uterus. So there's all those things causes inflammation of the uterus and reduces the chance of implantation. It can cause heavy periods and menstrual periods. But here we are mainly interested how it can cause infertility and how it can cause failed IVF cycles. So the reason it can cause infertility is the whole uterus even inflamed, the function of the uterus changes. So what happens normally is because of estrogen, if uterus is healthy, uterus contracts towards fallopian tubes from the cervix, which means it sucks in the sperms into and pumps into the uterine cavity. From there, it pumps the sperm into the fallopian tube where a released egg meets with the sperm. Then after ovulation, if uterus is healthy, if you don't have adenomyosis, then it pumps embryo back into the uterus because of pressure changes, because of movements of the uterine muscle changes between first 14 days and second 14 days of menstrual cycle. In adenomyosis, the muscle or engine of the uterus is broken. So you have erratic contractions, which means sperm cannot be transported properly, or embryo, which fertilized, which should come back to the uterus within 5 days, may not make it to the uterus, which causes ectopic pregnancy. A lot of patients with a history of ectopic pregnancies or biochemical pregnancies, they have adenomyosis because whole uterus is inflamed and it's not functioning properly. And also, a second reason is actual swelling of the uterus may actually even block fallopian tubes, because uterus, normal size of uterus is approximately 60 to 80 cc's. In adenomyosis, it can get very swollen. It can get to 160, 200 cc's. So when you do laparoscopy and look at the uterus with adenomyosis, uterus looks swollen, globular, very round shaped, and also hot and inflamed. So this can cause ectopic pregnancies, it can cause failed implantation. So, and this is why adenomyosis causes infertility. Typically, it goes undetected and it's categorized as unexplained infertility. Until you investigate, see the adenomyosis, you don't know why this patient couple is not getting successful pregnancy. And adenomyosis is one of the causes of unexplained infertility, which usually gets detected when you do IVF. And then you explain why this patient didn't get successful pregnancy. So, and yeah, so impact of adenomyosis in fertility, it can cause infertility due to change in the movements of uterus, which uterus works like pump, yeah? We said pump is kind of in adenomyosis, the pump gets broken. So uterus starts contracting erratically, not in the right direction. Second, it causes infertility because it can block the fallopian tubes because of swelling and inflammation of the uterus. Third reason it can cause infertility is mainly in the reduction of implantation. So yes, you can get successful pregnancy, but chance of implantation reduced. But it doesn't mean that patients with adenomyosis should get alarmed. So a lot of patients get successful pregnancy with adenomyosis. Unfortunately, adenomyosis is common, but a lot of patients get successful pregnancy without having any infertility naturally. And a lot of patients get successful pregnancy just doing simple IVF, and some patients need to do more individualized IVF treatment. So yeah, like endometriosis, adenomyosis is common. Patients or women should not get alarmed too much, but it's important to be aware. This is an important factor when you take a decision in terms of what treatment you should do and how you should individualize IVF treatment.